Hi, I'm Ada Wells, and welcome to the ProBalance PT channel. I'm a physical therapist and certified Pilates instructor, and what I'd like to talk to you about today is our knees. And I get questions quite a bit about knee pain. And one of the most common issues with knees are, you know what, my knee hurts when I'm running. I run for a little bit. It hurts, nothing that I, scream home about. And then it's something that just keeps getting progressively worse and worse. And they wonder, what can they do about it? First of all, let's talk about why you may be having knee pain. There are, a variety of reasons why. There could be degenerative issues, and sometimes it's more of just a alignment issue with regards to the knee. And I always refer to the knee as the dumb joint. It does anything that the hip and the ankle tell it to. So for that reason, when we're dealing with knee rehab, yes, we need to strengthen the quadricep muscles. We need to strengthen the muscles around the knee. But more and more importantly, we actually need to strengthen the muscles around the hip and then work on the flexibility in the ankles. Because what happens every time you take a step, when that foot hits the ground, it's going to affect the entire kinetic chain up. So if you are stiff in the ankle, you're going to end up moving and you're going to have a lateral motion within your knee, which then is going to create a different pull on the quadricep muscle when you're going through and actually engaging that muscle. So for a runner, they may be going through, and if that quadricep muscle is being pulled at a little different angle, it's going to create a little, the kneecap is going to kind of translate over to the side, and that can create some wear and tear behind the kneecap. So that kind of gives you, when it's sort of that pain, it feels like it's not deep, but it's sort of behind the knee, behind the kneecap. That's what we call patellofemoral compression. And over the course of time, you can actually start wearing down the cartilage there, and that can become more serious. So very important that you work on flexibility, once again, of the hip flexors especially, at the ankles, working on the VMO, which is the kind of more the medial, the middle part of the quadricep muscle, but the glutes. And so with that, I often say if you can work on the alignment and work on those particular items, that's going to clear up also a lot of other issues that you might have with your knee. So say you're somebody, you had an old ligament injury way back, and now you actually, or maybe a meniscus problem, it's, old skiing injury, and now you have some degenerative issues happening in your knee. Now note that you can have somebody you can have two people that have the exact same, yes, I had a medial meniscus tear, but they have completely different symptoms. But you look at their knees and they're shaped totally different. So once again, it comes down to alignment, how the force of gravity hits that particular part of your knee when it's moving. So if we're able to optimize with every step, each time you are standing on one leg, it's controlled balance. So if you have poor balance, once again, that may change the alignment of those muscles. So working on the balance, working on the strength of the hips, mobility in the ankles, and working on the strength of the ankles is going to be very important. So with that, there's many exercises that we do in the Pilates world that do integrate lower body strengthening and flexibility, but even more importantly, how you can stabilize the core on top of the legs. So if you're able to do all that, the knee actually becomes a much more healthy joint. Okay, so with that, hopefully you will have healthy and pain-free knees, and we'll talk to you next time.